So don't forget to follow me on Instagram, High Carb Health. Hit the follow button and click on the green H to see what I get up to. What I eat, what I do, it's all here. You can follow me on what I eat as well. So check it out, guys. Hello everyone, I'm here with Dr. Renae Thomas. Welcome to the channel.
Hi, thank you so much for having me. I'm very excited to be here and to talk to all your wonderful followers.
Awesome, Dr. Renae. Well, I'm so excited to have her join us here today because Dr. Renae Thomas has compiled one of the best articles I've ever read on the evidence between diet and IBD. And so we're going to be talking to her today a lot about some of the research you've done. But before we do that, I'd love to hear your story. Talk to us a little bit about how you find out about going plant-based and why you decided to choose a plant-based diet.
Sure. So super short in a nutshell, when I was really young, I was like 5 years old, my father unfortunately had cancer. He was only in his 30s. It's really crazy. And on the advice of his oncologist, believe it or not, found out about the link between red meat and colorectal cancer that was, kind of emerging in the early 90s.
Sure.
Not really much else out there about plant-based nutrition and disease prevention, but that was one of the early studies that was kind of, I guess, accepted and recognized in the medical community. And he was a very avid reader, researcher, and he thought, why have I never heard this before? And is there more to it? So basically read the whole library, came across many of the names we all know and love, Barnard from this conference, Nathan Pritikin, Dr. Don McDougall, Caldwell Esselstyn, and the Adventist Health Studies, which talk a lot about the links between vegetarian or plant-based diet and cancer. Cancer, not only prevention, but also recovery, relapse, and lots of good stuff. So he did an overnight and went completely plant-based and major daddy's girl. I was like, well, if daddy doesn't eat it, I'm not going to eat it. And it's actually really sad because the year before, I had an uncle pass away from colorectal cancer. And so there was a lot of motivation in our family. What can we do? What can we do? So I have been entirely plant-based since I was 5 years old.
Wow. Wow. And they say you're not going to get enough protein.
I grew into a fully fledged adult, managed to have enough brain function.
Surprise.
Yeah, I think I did okay without the protein.
Yeah. So let's quickly talk a little bit about the research because, as you know, our channel is heavily focused around digestive health and the gut. So the research that Dr. Renae's done has been obviously done a lot more than just IBD, but this article that I'm going to link in the description below is one of the best articles that we've read. And I just want to talk briefly around some of the things that you talked about. So first of all, the evidence behind taking medication for IBD, such as ulcerative colitis and Crohn's disease. What does the research say about how effective the medication is?
So obviously I'm traditionally trained medical doctor, and I'm certainly not opposed to traditional medical treatments, especially in the acute event. Things like severe pain, trauma, acute events. A lot of the time, medications are extremely useful for just, dampening down or extreme symptom management. One of the ones I talk about a lot when I talk about my dad's story is antiemetics or anti-nausea, anti-vomiting medications. People that used to take chemotherapy, my dad used to throw up buckets and buckets of vomit. And that's just not a thing anymore because of these drugs that we have. So focusing more on, like you say, IBD, ulcerative colitis, Crohn's, I think there's a role. It's not, I'm not a gastroenterologist. It is not something I typically do. I tend to see patients on these medications and have worked with people concurrently taking them, but it's not something I typically prescribe myself personally. However, I think Alan Desmond gave a good overview of it yesterday. Very early treatments were things like steroids, just dampening down that inflammatory autoimmune sort of attack on the body. Now, I think, I'm familiar with a lot of the stuff you do, whether we entirely believe that model or not, I'm not entirely sure. Is it just a dietary induced illness versus an autoimmune, a combination of the two? Hard to say 100%. I'm not 100% sure where I lie yet. But there is definitely clinical response to these medications. The problem is not everyone responds. And I heard your story yesterday. Not everyone responds. not everyone maintains. And I think one of the studies that I looked at, usually around 90% will have some kind of relapse within the next 1 to 5 years on any type of medication. So after the steroids, so they're generally your acute ones. People that then keep having flares will be put on some kind of immune modulator, one of the 1,000 IMABs, my favorite one being ABCD IMAB.
Oh, really?
I find that one rather amusing, but or something like a chemotherapy agent, azathioprine, and I think the one that I can never, that's another one, and like mesalazine. There's a group of medications that come out, and they're usually for your chronic relapses. Some people have great responses to these. They're on them for a few years. They come off. They maintain symptom-free for a while. Kind of your typical progression. It is a relapsing and remitting. The typical term being a classic relapsing and remitting autoimmune condition. That's the medical belief. And it's finding the right medication to prevent that happening. And unfortunately, for some people, that is not the case. And that's where I think we find patients asking, what else can I do? Because even if you are on a medication that would be considered, let's say, good, you get 1 relapse a year, that's considered pretty good. Do I really want to have another, couple of weeks in the hospital, chronic pain, bloody diarrhea, blood transfusions, all this stuff that can often go along with a relapse, significant weight loss? There's a lot of motivation to think, how can I prevent that?
Absolutely.
Whether you're even thinking about coming off medications at all, or whether you just want adjuvant therapy to improve your odds of being successful on the medication. So I think there's a role for them, especially that initial dampening down. For some people, they have great response. Other people, it just doesn't seem to work.
And I think we definitely agree with that in the sense that we are all about obviously we want to work with the doctors when we come with our clients and things like that, but it's not about being against medication as such. What we don't want people to see is that the whole idea of being on medication for the rest of your life. And there are some very severe side effects to these medications, and we don't know what's going to happen. So if there is a chance and there's a possibility that you can get off them and live a healthier life without them, like Shamiz is doing, then I think that's something that should be pursued. And so that's where we're going to come to in a second with prevention. So, some of the people watching this video do not have an IBD, and I think the best thing, prevention is always better than a cure. And you really did write well about that in your article too. So let's talk about prevention and what the studies say about that.
So there's quite a lot of studies coming out looking at, so a really common type of study that we look at in medicine is what we call a case control. So this is finding people that already have inflammatory bowel disease and then finding people that would be considered a control group, or people that are similar enough. So you want to match for things like age, gender, kind of lifestyle experience. They're always at risk of overmatching and undermatching, but we do our best. And then you look back and see what exposures the people that developed the cases, or the people that now have inflammatory bowel disease, what did they do versus people that didn't develop it? What did they do differently? And that's where we get a lot of our research for like medical conditions and preventative factors. So one that is emerging that obviously you guys are familiar with is looking at the role of animal protein, inflammatory foods, looking at dairy products and what they do, and then looking at protective factors, high fruit and vegetable intake, high fiber intake, and looking at what these do. There's a bunch of information emerging with the microbiome and looking at how changes in the microbiome affect the integrity of the bowel, the inflammation of the bowel, the risk of ulceration in the bowel. Even things like stress management have evolved. We've kind of gone beyond that model of thinking stress caused stomach ulcers, but we do see higher stress creates these situations. Maybe it's just a lack of sleep and high cortisol that affects our ability to heal, but there's a lot of emerging research with that as well in terms of prevention, and that's what we're seeing. So a lot of the prevention measures is like, well, if this is what, if our cases are having lots of animal protein, lots of meat, lots of dairy, lots of eggs, and our controls perhaps are having less, well, if we shift towards what the controls are doing, would that prevent? And that's where a lot of the prevention idea comes from.
Right.
Epidemiological studies are another one. So this is looking at big sort of observational type. So not giving any interventions or anything like that, and looking at what people do, and then either comparing like suburbs or comparing countries and seeing who has more rates than others. People are very familiar with Dennis Burkitt and a lot of his stuff, you know, Dr. Fiber, looking at a lot of that, working in rural Africa and not seeing these bowel conditions. Sure. I know you specifically focus on inflammatory bowel disease, but, you know, it's intrinsically linked. Diverticulosis, colon cancer, colorectal cancer, they're all inflammation of the bowel. And not seeing it in these countries with traditional plant-based high fiber diets, if they're not even getting the disease, it makes you think, if we shift to that, is there a component of prevention? And then you have, you know, not as many as we would like, but our controlled clinical trials, our randomized clinical trials. These are few and far, but we see them more in treatment. But again, my thought is, if something treats a condition, if you live that way, will you again prevent it? And I think that's sort of my thinking about where prevention methods come in.
Fair enough. And we see that with heart disease as well, don't we? The same diet that reverses it will also prevent it.
Exactly.
So let's talk about treatment. And there is some really good research coming out around treatment as well, isn't there?
It's very exciting.
So what does that tell us?
So probably one of the most known and most clinically randomized trials is the one out of Japan, the hospital study that I mentioned. And that is vegetarian, but I would consider that far more plant-based than you would typically think. I believe the maximum was 1 yogurt every other day. And that was the only animal product they included. And I think maybe an egg was included. It was very minimal compared to what one would typically consume in an omnivorous or a vegetarian diet. You know, we look at a vegetarian diet, it's often very heavy dairy laden. Some consume eggs, some consume fish and chicken. The term vegetarian is a little vague. And they found, now I'm going to botch up the numbers, but I believe it was a very high percentage that induced remission and sustained relapse prevention by following the vegetarian compared to just standard of care.
Correct. I think if I remember correctly, it was 100% in the first year and 92% in the second year.
I know that they're very, very, very high, well beyond anything we see from medications. I think the real key that got me interested in it was looking at the elemental studies. That was sort of your first line, especially in the pediatric population for inflammatory bowel diseases, seeing that essentially taking food away, whether it be bowel rest, in elemental diets, TPN or IV or through the neck, or those kind of those kind of nutrition resolved the condition. So that immediately says to me, you know, Dr. Clapper, Dr. McDougall's lines of, it's the food. Because if you take away the food and you get better, there must be some element of food component. Unfortunately, you know, and it's one of the things with the True North Health Centre or the fasting centre that I went to, one cannot fast forever.
That's true.
And so it's like, how can we eat and maintain, achieve, sustain all those results that come with not eating?
And so I think typically if we look at some of those studies, you know, they implicated animal protein, didn't they, as a big risk factor. Dairy was another big risk factor. What else was found? I think there was some information around omega-6s.
So again, with omega-6s, it's the pro-inflammatory component. So we have omega-3 and omega-6 in the pathways towards arachidonic acid, which is your inflammatory component, and then your anti-inflammatory side. And these compete for the same mechanism. So if you're having high levels of omega-6, they're going to flood all the receptors, bind to everything, use up all the enzymes, and blocking out your anti-inflammatory or omega-3 pathway. Your traditional plant-based diets have a much higher omega-3 component to an omega-6 component. Modern food, processed oils, processed grains, all this, you know, even high levels of nuts and seeds, they can just push the level. It's really oils. Oils is where you really see it, because you know, we're taking a food such as nuts and seeds that do tend to have higher omega-6s, but then we're concentrating them down into a processed food with high levels of omega-6, and you're just pushing out the omega-3 pathway, especially when, you know, you're trying to get that from, often in a plant-based diet, your greens, your leafy greens are where you're getting lots of your omega-3. But if you're dousing that in oil, you know, it can't compete. Other things that are implicated, a lot of them, food additives, food preservatives, you know,
Emulsifiers.
realistically, these are toxic food-like products. You know, I'm almost unsure whether it's the ingredients themselves or just the processed foods that they're contained in. And that can be difficult to down. So I think that's why maybe we throw the baby out with the bathwater. But the whole food, plant-based, is really an approach that just eliminates those. Those foods aren't helping anyone in any way, regardless.
Absolutely. So if you'd just like to summarize in quick bullet point form, what is the best thing that someone who already has IBD can start to think about doing?
It really depends where they're at, and at that point, how sensitive they are. Because whilst we have good evidence for a plant-based or even semi-vegetarian diet, not that that's where I go to, but that is where we have good evidence for. Someone that's in a huge flare, I think that this is forgotten sometimes because they can't tolerate that diet. That alone is too painful and too diarrhea-inducing. So that's why I kind of outline in the article very simple steps of starting where you're at. If you have IBD but you're not in a flare, you can probably quite easily transition to the whole food plant-based diet that we talk about. That is intact whole grains, fruits, vegetables, legumes, and small amounts nuts, seeds, and avocado, minimizing any added salt, oil, sugar, or oils. That would be quite appropriate, provided you can tolerate it. Now, if you're going from often what is recommended, that low residue or low fiber diet, you may have a little adaptive period because you need to have the time for your microbiome, the old microbiome to die off and the new microbiome to repopulate. So I do caution with some people going a little easy on the beans initially. Don't go from having a white bread sandwich to a pound of vegetables and a can of beans. Probably going to be uncomfortable. So I think for those that are not in a flare or a relapse, just slowly incorporating the amount of plant-based they eat and really focusing on minimizing those inflammatory foods that we talk about and that are irritating to the bowel, that generate poor microbiome for healing. So that is the animal protein we're talking about. And sometimes I try and avoid these words because I feel they're confusing. You don't have animal protein on your plate. We're talking red meat. We're talking fish. We're talking chicken. We're talking eggs. We're talking milk, cheese, ice cream, yogurt, all of those foods. And did I say eggs? All of those foods encompassing animal protein. Then we're talking the high omega-6. Again, this is your oils. Oil just really, it is the highest processed food. I feel like people recognize that white sugar is poor for health. Oil is the white sugar of the fat world. I would even make the argument for protein powders, and I know that is encouraged. That is the white sugar of the protein world. So that would be a big step away from that. So you've got your animal protein, your dairy products, dairy being anything from a cow, that is butter, cheese, milk, ice cream, yogurt. I don't even know what else they make from milk anymore. All of those foods gone. Your oils, I would even say a large amount of nuts, seeds, and avocado, depending where you're at, could push you over that line, especially if you're not balancing it with your flax, with your chia, with your walnuts, with your DHA vegan base, with your tons of leafy greens to push into the omega-3 side of that. And then obviously anything added that isn't food just really needs to go. Where do you go if you're in a relapse or a flare? Because that, I feel, is where the challenge is, because eating that may not work. And that's where I sort of outline different ways, whether that be a brief water fast. Not everyone has the luxury to go to somewhere like True North or a medically supervised water fasting. I believe for most people it's safe to do a day or two at home unless you are on medications that require food. If that's not an option, a couple of days on juice would be relatively safe to do at home. Or do you go to your super soft, easily digestible fruits, your bananas, your papaya, even if they have to be blended or juiced or, smoothies, just really gentle, taking a few sips, having a few teaspoons, whatever you can tolerate, listening to your body. I've seen coconut water, just gentle nutrition, hydration, and then building up from there. So when you're tolerating puree, do you go to like a mashed banana or a super soft fruit? They often use watermelon at True North Health Centre, just really gentle healing. And you just keep stepping it up from there. If you can't tolerate that, can you tolerate well-cooked, pureed, pumpkin, sweet potato, things that are just really soothing and gentle on the bowel? And you might have to do that for a few weeks or so while all this ulceration and inflammation has time to heal.
That's right.
The body can heal, but not overnight. Yeah. And then you go from there, and I'm sure that your story would incorporate a lot more now. I looked at your Instagram. You have some great looking foods. You're not on puree food anymore. And that's amazing and inspiring to see for people that you can eat these fantastic, whole food, plant-based, delicious meals. You're not on puree sop forever. Yeah. But it's just working towards that. And I'm sure your story probably incorporated a lot of that.
Absolutely. And that's exactly what we suggest to all our clients that start with us. First of all, you have to ease your way into it because some people are coming from a heavy animal food-based diet. Exactly. So you've got to first of all try and get onto plant foods, and then depending on how they're feeling, we might start to make it a bit softer and easier to digest, and then kind of reintroduce foods from there. All right, everyone. Well, that was very, very informative, and I think, as I said earlier, if you need some more information on the work that Dr. Renae's done, there's the link to the article in the description below. Thank you so much for joining us. It's been a real pleasure. And wish you all the best with your work you're doing in the US. And thanks once again.
No problem. Appreciate it.